We utilize complementary therapies at Care Dimensions because that integrates mind, body, and spirit into the physical care, and we take care of the whole patient.
How is your shoulder and your hip doing these days?
It's been working very well.
Things like massage therapy, Reiki, these sorts of complementary and alternative therapies can really help with symptom relief, and it gives people that relief and that comfort, and it also honors their wishes to not rely on medication to do that.
Summertime and the living is easy.
Even when people aren't able to show a lot of response to words and so forth, words aren't necessarily making sense to them, music can often bring the feeling of being accompanied on a journey, bring the feeling of not being alone.
Talking about our boy, it brings us lots of joy.
Hi Mildred, it's good to see you today.
Complementary therapies, music therapy, pet therapy, massage therapy, these evoke sensory experiences in the patient in a nonverbal way and can trigger positive memories. It can help them with their life review, and it can help them do that inner emotional work that needs to be done as part of the dying process without relying on the spoken word.
It's bringing something extra to the patients, and I think they really enjoy it and they derive a lot of comfort on a lot of different levels.
How is that right under here?
That spot is good.
At Care Dimensions, we're always thinking about what can we do to bring in other tools, other disciplines, other practices that are going to help us enrich the final days and weeks and months of a patient's life.
How you doing?
I see the stress with families just goes right down when they talk to Tessie and they just keep petting her, and I always hear how soft she is, and it certainly does relax the patients' families as well as the patients.
Bye-bye. Bye-bye, Warren.
Bye-bye.
The growth of our complementary therapies program has really been quite remarkable. 6 years ago, we were making maybe 300 or 400 visits annually, and last year we had 4,500 complementary therapy visits.
Little did we know about all the complementary therapies that were here until my husband was a patient a little over a year ago. My husband was a huge music fan, and when he was here, Lisa, the music therapist, came in and asked if she could sing something. Before my husband died, he died sooner than we thought, he did have a few requests. So I thought, and I said, Lisa, how about Silent Night? And she said, I think I can do Silent Night. And then I told her about the fact that he had requested that it be sung in German at his funeral. And she said, I'm German, I can sing it in German. And I think it was probably one of the most wonderful moments of our marriage. And just to see the peace and quiet that came over Gene was a special moment for him, and it was a treasure for me.
You've seen the tremendous positive impact of these services, and we want to continue to provide them to all our patients and families. So we ask that you please give as generously as you can, and we thank you for all the support that you've provided for programs like this.